So there is urgency in increasing our effort and improving the quality of the operational research. I believe it can become a true new scientific discipline. I don't know what will be the right forum, whether it is this type of conference, whether it's the sort of conferences IAS organizes or sponsors at the regional level, or whether it is the implementers meeting that PEPFAR has initiated. But we will need a forum, and probably we will have journals to cite it. But it is a new and emerging science, clearly. Another point I'd like to make is that operational research is, of course, one example of how evidence can improve performance, but also transparency about what people do. And transparency, including transparency about our own mistakes. That research should be of the highest scientific standards. That's an ethical must, of course. And it should search for innovative methodologies. We can't just go by randomized clinical trials. We have to learn from cohorts, multidisciplinary cohorts, and we have to find new designs. We have to, I do believe we still have to go for hypothesis-driven research, because otherwise I don't understand how we could interpret results. But we probably need to be very flexible and adaptable, probably in the type of hypothesis we state, and maybe during the course of the research or of the follow-up of the cohort, be capable of changing some of the objectives and some of the hypotheses. Now, within the framework of scaling up operational research, a few months ago, in March 2008, WHO, the International AIDS Society, the World Bank, and the Global Fund convened, and I'll tell you why the Global Fund was there, convened a consultation to identify knowledge gaps in public health approaches to delivering ART and care in low and middle income countries. And there's a consensus statement from that consultation, which you will find on the table outside the room. And among the many challenges that appeared and that we will have to overcome to implement these research priorities, there is first the need to build and to promote, in-country research capacity, clearly, so that it is the countries themselves that set the agenda and that conduct the research, rather than, as it has often been the case before, somehow imposing the agenda of academic institutions from the developed countries onto the developing countries. Second, it's strengthening health information systems to really capture the information, collect appropriate data, and being in a position of validating, of having validated data. And finally, improving management systems and other mechanisms so that we ensure translation of research then into policy and practice. Let me just give you one example from, which is a Global Fund example in real life. This is about a hospital in Sudan, the Maltaser hospital, that was totally disrupted by the ethnic conflict in Sudan. It's a TB treatment hospital. And to actually be in a position to implement TB programs, the hospital tested the effectiveness, rather to keep the patients in hospital, to release them and have them followed up in a community health workers setting. So before the intervention, the TB patients actually spent 6 months in hospital until they would complete their full course of directly observed therapy. after the intervention, patients were discharged from hospitals after 2 months and then referred to community health workers for continued treatment. And the cure rates for patients treated in hospital historically in 2004 versus patients remaining for 2 months in hospital and then referred to community workers were 72% and 82% respectively. So obviously the conclusion was then that the rapid expansion of referring to community workers in that particular context of Sudan became a recommendation. Why was Global Fund participating in that consultation? For 2 reasons. One is that, as you may know, the Global Fund disburses on the basis of performance-based funding. That is, our funding mechanism is based on performance, which by itself creates the opportunity for strengthening data collection and the health information systems alongside. And second, because we are actually able to fund operational research. And this is something that people maybe do not know. Up to 10% of Global Fund grant budget, and that can be considerable, as Global Fund grants are tens of millions, if not hundreds. Up to 10% of a Global Fund grant budget can be devoted to monitoring and evaluation as well as operational research. So we're currently working in the Secretariat on how we could make this better known. We are funding a number of studies that go, and that is extremely heterogeneous. It would go from DHHS surveys to effective research protocols. And again, often that money is not used or is not requested from us. This would also mean that researchers have to link with the CCNs in countries, because it's the CCN that designs the program, and that the researchers should also consider how they could bring technical assistance and technical support to countries for them to include in their requests to the Global Fund an operational research component. So these are the few remarks I wanted to make, and perhaps let me just recap some of the points. The first is that I do witness, particularly as I transition from one area to the other, a gap, quite a profound gap and disconnect between the research community and the implementers community. And we need to close that gap and have these communities interact. Second, we need to build that new science with the highest scientific standards that have to be, and with building in multidisciplinarity from the very beginning. Third, that new science has to link with in-country systems, information systems, in-country indicators, not to invent new things, but rather increase the quality of what is being done in collecting data. Third, it has to be flexible. It has to serve to build a new type of collaboration between institutions in the north and researchers in the south. It implies that we devote enough effort and money to strengthen research capacity in the south and in implementing countries. And my last point was about the fact that the Global Fund will welcome from you requests that will include a strong operational research component. As I said, this can go up to 5 to 10% of the requested budget. Thank you.